Essentially, music therapy is about making music with someone. So it doesn't really matter whether that person is coming because they're an inpatient in a psychiatric hospital or because they're someone who's been referred for emotional behavioural difficulties, or if it's a toddler or an older person with dementia. However, obviously, each person has their own musical heritage and history and culture and likes and stuff. And some music is more appropriate for some ages than others as well. So you're not going to do nursery rhymes with an adult. And older people might like music that you associate with their generation, but they might not as well. So we will try not to make any pre-assumptions about what kind of music we'd be using. I suppose we would try and tailor the instruments. So, if you're working with an adult, you need adult-sized instruments. I think a lot of people are put off music therapy by the idea that you'll be a child again. You'll be back at school playing a tiny little glockenspiel or something. You need big instruments that give people real satisfaction to get stuck into. So if I'm working with adults, I'd normally have some big conga drums, maybe a big xylophone, guitar, piano, big percussion, drum and cymbal kind of stuff. So stuff people can get stuck into and take satisfaction in using. And then essentially you see what happens. So some people come in the room and they just go for it. And then the therapist just does what they can to be with them and helps them to make a kind of shared experience in the music. Some people need much more encouragement, and then the therapist will kind of ease them into it and suggest ways of trying things out and see what they like, see what excites them, what's not interesting for them, and take it from there. So it's really different with everyone. In an individual session, the therapist can really, to use therapy jargon, attend to the person. So we really try and listen to what they're doing and hear all the kind of musical potentials in it. So, for example, someone might play quite repetitively, but then they offer something a little bit different. You try and pick up on that and offer it back to them and see if they take it up. Someone might come and want to write a song, so you'd help them to write a song, which is how they want it to be. It's not for the therapist, it's for the client. So you can give people a lot of individual attention in an individual session, obviously. With a group, you can't do that so much. So you can give each person a little bit of individual attention, but it's also about working with the whole group. So in a sense, you're kind of accompanying the group rather than just all the individuals in it. And groups are also about the people in the group kind of attending to each other and being responsive. So a good group works when people take on multiple roles. So like sometimes someone will do a solo, and sometimes they'll take a bit of a back seat, and sometimes they'll learn from what someone else is doing and stuff. And ideally that all works really smoothly and flexibly. So a music therapist is there to kind of help that happen, provide ideas if necessary, but often it's not necessary. What you really need to do is kind of underpin it musically. Sometimes we work with people who are really quite musically skilled, so they're musicians. And they're very competent, and other people need more musical support from the therapist to make it feel like real music. So in a way, we kind of supporting what's there and adding in what's missing. So if someone comes in, you might have a group where someone's playing a melody on an instrument and you've got like a couple of people on percussion. You probably need some bass line in there somewhere, so that would be something the therapist would do. They'd think about the harmony that's underpinning it. Other times you might have lots of people playing guitars, for example, and you need something more percussive with it. So the therapist will kind of add in what's missing and shape it a bit, and then try and make sure everyone is involved and it's not just one person being the star all the time. So, you don't need to be an amazing musician to come to music therapy. You don't need to be a musician at all. I would say that everyone's a musician. I mean, that's the kind of fundamental principle of music therapy, really, that all of us as people, we're musical because of the way we talk and the way we walk and the way we interact with each other. Even our body movements and stuff are all musical. We're born doing that as children. It gets a bit whacked out of us by life sometimes, but we need to go back to it and feel what it's like to be creative and musical with each other. And our job is simply to help people do that in a way that's relevant to the situation they find themselves in. And often it's about reconnecting people with music. So I've worked with a lot of people in mental health environments who say, you know, I used to love music, or I used to play the guitar, or I used to write songs or something. And you can help people reconnect with that, get back into it and feel, yeah, I can do music, and music is a resource I can build on. I don't need music therapy forever, but I can get back into using music as something to keep myself healthy. They're coming because they enjoy making music, because it's motivating, because it's meaningful, because it gives them a sense of aesthetic satisfaction, it gives them a sense of fulfilling their potential and feeling alive and doing stuff well. And I think that's so important, because it's the stories of people themselves that really justify the work we do.